16 years ago, when I first stepped into what was then called the Royal Victoria Hospital, I was traumatized by my experiences. The suffering I witnessed, I had never encountered before. The events that unfolded in the subsequent years brought me closer to my vocation as a doctor, and indeed cemented my passion for volunteerism, returning to the Gambia to work charitably year on year. The decision was therefore very clear in my mind. Yes, we can, and yes, we will bring the best healthcare in the world to the Gambia, because the question is, why not?
In a nation where 60% of the population lives in poverty, and access to basic healthcare is a challenge, interventions such as the Horizons Trust Initiative are needed to help curb the levels of preventable deaths, mostly affecting pregnant mothers, young children, and infants.
In 2007, we decided that we needed to do more for the health system, to work in a more effective way with the ministry. But to do so, we needed to use a model that was self-sustaining, financially self-sustaining. And that's how the Horizons Trust and the Horizons Clinic idea started in 2007.
Horizon Trust Gambia's mission is to make a major contribution towards increased access to affordable, high-quality healthcare for all Gambians, helping to make pregnancy and childbirth a happy event.
Given the challenges of maternal health, given the challenges of mothers dying during childbirth in the Gambia and in other parts of Africa, it made sense that we focus on improving maternal mortalities to stop women dying in sub-Saharan Africa, because in doing so, inadvertently, we would have strengthened the health system.
Horizons really, the way I interpret it, is about aiming for more, aiming for higher, raising standards, embodiment of the fact that we are people that are worth more and that we should do more for ourselves. That is for me what Horizons is about.
A major focus of Horizons Trust Gambia's activities is aimed at capacity building. Training and continued professional development are key elements of this. The Gambia and other West African countries have a critical shortage of trained health workers. Whilst there is a need to train community and mid-level health professionals, the Trust's immediate priority will be in training the trainers, the specialized health professionals, and ensuring that there is a program in place for continued professional development.
The first strategy was on training, and indeed we trained just midwives and nurses in 6 health facilities. Then we realized that there were problems, of infrastructural problems. Yes, you train them on infection control and prevention, but they tell you, look, we don't have water, we need to wash our hands. So why? Because the taps are not working, the taps are leaking, the toilets are not working. So we said, right. We then focused, then, in addition to training, to infrastructural changes.
Horizon contributed immensely to this hospital. They've already provided training for all the cleaners, including myself. Not only me, even some of my counterparts. They've also provided sanitary materials, bleach. So all what we needed for cleansing materials, they have been providing that for us, and which is very forthcoming. They also provided dustbins. They've installed taps, showers, flush toilets. They've also installed washing machine for us. They've also electrified the entire ward. Yes, that's both the pediatric ward and then the postnatal and then the delivery ward. They've installed almost about 30 solar panels, accompanied with almost 18 new batteries.
Horizons Trust has intervened so far with 5 communities of varying sizes in order to assist with growth models and to effectively add value to the approach in battling the spread of infections.
And at each of these facilities, we have had a pilot of a training program, which we did with our partner Soapbox, where we have 8 clean boxes and very practical, demonstrating, engaging everybody, because it's really about ensuring that the people whose primary job it is to keep the environment clean are understanding what they're being told. We had to look at a way in which we could create this training sort of package in a way that it's translated into local languages. But also, for us, it's always about sustainability. We want to make sure that facilities, whatever our interaction is with them, the facility is able to then continue. So when you say, some people say to me, how many people have you trained? Well, actually, we've trained more than what we've trained directly, because our trainers are then going on to train more staff.
IPC, Infection Prevention and Control, is a scientific but basic approach and practical solution designed to prevent the spread of infections to patients, health workers, and the community at large.
Infection prevention and control is key to health services, for the simple reason that one of the major causes for the deaths of mothers and children, particularly during the delivery period, around that time, when they deliver, just after they deliver, is infection. Infection is a serious concern, and if we can focus on prevention of infection and how to control it, we'll be able to save more lives.
District hospital have a catchment area population of about 400,000. If we look at it, the institution alone, at the maternity wing alone, let me quote it from 2016. 2016 alone, I've recorded about 5,232 deliveries.
In hospitals like Birkama Health Center, sanitary hygiene was extremely poor.
I came here, I didn't find any sanitary, materials being provided for this facility. No sundries, no sanitizers, nothing, no Omo and so forth and so forth, no cleansing materials. I was about to cry.
The toilets were condemned for so long a time now. They were not functioning because a lot of them were damaged.
So you and me, how can we stay in a residence that doesn't have a toilet, and we are eating and drinking? The same thing applies to those patients. Let's put ourselves in their position now. Let's have empathy. Let's put ourselves in their position now. If we are there, admitted there, and we have the urge to go, where are we going to?
These same stories echo from the Sir Edward Francis Small Hospital in the nation's capital.
Digante bi ngeen ñëwee ak before dafa def naa ne 100% different because yu bëri dafa indi changes ci yenn seen site yaa ngi dégg toilets yi ni ñu setee nii musuñ ko woon a setee.
The sink, the toilets, the bathroom, everything was made up, even the staff toilet, because before staff to be having toilet, it's a problem. We normally go to other wards, but now everything has been renovated.
They even have improved the department. Because those days it was difficult. The hospital could not run everything, like cleaning the environment and changing on some of the material that we had. But when they came in, they really supported.
These facilities don't get any provision. There's no rolling delivery. They have ad hoc from people who want to help sometimes, but they actually do not know when they're going to get their next supply.
Through training exercises and continued professional development, not only is capacity built, but attitudinal change starts to take effect, where approach to basic medical hygiene could lead to the eradication of the spread of deadly infections in the community.
We take attitudes, and we have not only focused on the nurses, we have focused down the ladder, the orderlies, the support staff, laundresses, etc., because they do have to understand.
The training, the knowledge and the skills that we were trained on I was never taught about them in school. So it's like it had a great impact in my life as an individual and again in my profession.
They have added a lot of value. Number one, they have decreased the workload. Number two, they have made the environment conducive for both with the healthcare team and then the patients. Obviously, you can see a difference before and after.
After receiving the training from Horizon, I saw a huge, change in how I think, how I do things, and also how I talk to people about infection prevention and control.
We are definitely pleased with the training of our orderlies, because like if you impart knowledge in people, you empower them, and before doing anything, they have definitely put that to us, train our orderlies and health laborers, give them the required skills to be able to carry out the functions well.
As of now, we hardly had a complaint of any infectious patient. Even those gone on CS, those days we discharge them after 7 days, sometimes 10 days because of the infection that they will have. But now we have really improved. We hardly have anybody admitted, even for CS, C-sections, for more than 3 days.
You have like 10 cases or 5 to 10 cases per clinic for sepsis case. But now if we go to the facilities to gather data, we see to it that it has dropped. Maybe some we just see 2 cases or 1 case reported.
Now Serekunda is different. It is clean. People are, those who have been not coming for a long time, now they are coming, because they've seen that what they've been seeing years back is no more available. The place is clean, the environment is conducive. Even if you admit people now, if you discharge them, they refuse to go. There is no electricity at home. Now you have 24 hours electricity on your head. Obviously, you cannot go home.
Horizons we use our connections, our influence. You know, we have access to people that, you know, that some people within the facilities don't have access to. So every opportunity we have, we're telling their stories. And we're making sure that every time we can, we're saying, you know, this is what they're going through. We listen.
As I said, the government cannot do it alone, and the Minister of Health cannot do it alone, and then partners have to come on board to complement the efforts of the ministry and that of the government.
Firstly, we need to join hands with other stakeholders, the most important, the Ministry of Health, others, the UN agencies, UNDP, WHO Gambia, UNFPA. We all need to join hands with our international partners to ensure that we raise the standards to protect the experiences of mothers and their newborn in the Gambia. And we need funding to do that. The Trust has done very well. We've had some funding from organizations such as Brussels Airlines and others, but we need so much more funding to ensure that every mother feels happy about pregnancy and childbirth. So we've got a long way to go.
With all that's been achieved, all that has been accomplished, it is evident that more has to be done. In this modern day and age, no woman needs to die of childbirth simply for the lack of basic medical attention. No child should die because of unavoidable and curable infections. Horizons Trust, of course, will need your support, for it's a few like you that made a change. Imagine how much more could be done with your help.